Hi, I'm Dr. Sheila Reyes from the Philippines, reporting virtually for Room Now at the ACR 2022. An interesting study by the group of Dr. Fabian Proft was presented at the abstract sessions on Saturday entitled The Comparison of the Effect of Treatment with NSAIDs Added to Anti-TNF Therapy versus Anti-TNF Therapy Alone on Progression of Structural Damage in the Spine over 2 years in patients with ankylosing spondylitis, or the CONSUL trial with abstract number 0546. A previous RCT suggested a potential benefit of NSAIDs in preventing structural progression in AS, where a continuous dose of celecoxib over a 2-year period showed an inhibitory effect on structural progression. Conversely, recent studies have shown that TNF inhibitors may have some inhibitory effect on radiographic progression as well. The objective of the CONSUL trial, which is an open label multicenter RCT, was to evaluate the impact of treatment with the combination of an NSAID and a TNF inhibitor compared with a TNF inhibitor alone on the progression of structural damage in the spine over 2 years in patients with radiographic axial spondyloarthritis, or AS. The investigators chose celecoxib as the NSAID and golimumab as the TNF inhibitor. Patients included in the study had radiographic axial spondyloarthritis and high disease activity, a BASDAI of more than 4, NSAID failure, and risk factors for radiographic spinal progression, such as a CRP of more than 5 milligram per liter and 1 or more syndesmophytes. The primary endpoint was radiographic spinal progression using the change in MSAS after 108 weeks. Okay, that was long. Results of this study show that the MSAS change after week 108 was 1.1 in the celecoxib plus golimumab group versus 1.7 in the golimumab alone group, with a p-value of 0.79. This means that there was no significant difference between combination therapy and golimumab alone in delaying the progression of radiographic changes over 2 years in patients with AS. Okay, so what do these findings tell us? Can we apply it to our clinical practice? For clinicians like me, interventions that can slow the progression of structural damage in AS are expected to provide clinical benefit in terms of delaying functional loss and improving the quality of life of my patients, which is also ultimately the goal of AS management. Now, on a personal note, I am not comfortable giving NSAIDs long-term because of the risk of developing GI, cardiac, and renal side effects. Now, just 2 things. First, the potential risks may outweigh the potential benefits if we do combination treatment. Second, the cost of treatment. In this side of the world where I practice, out-of-pocket healthcare is still the norm, and additional medications can burden the patient and may not be as cost-effective. Which brings us back to the study. Though combination treatment with celecoxib and golimumab was not shown to be superior over golimumab alone, either regimens can be considered. Stratifying patients at higher risk for radiographic progression may guide decision-making strategies. Less is probably more. Follow me on Twitter at Rumarampa and tune in to Room Now for more reports and videos of the ACR Convergence 2022. Thank you.